Hello, my name is Dr. Eric Fjeldheim. I am a physical therapist and therapeutic pain specialist practicing at the Prairie Lake Specialty Clinic. And today we're going to discuss some recent developments in the research and the science on pain. And first, I want to draw your guys' attention to the picture on the title slide. And what do you think this person is going to feel in about 1 second? Right? They'll probably feel some pain. Now, why is that a good thing? You might be thinking to yourself, well, I don't like pain. That might never be a good thing. Well, in this instance, the pain's going to signal you to do some things, right? You're going to sense that ouch. You're going to look down and you're going to see that there's a thumbtack in your foot. And that might signal you to pull the thumbtack out of your foot. Go get help, get it stitched up, or get it, if it's slid in there and caused a big gash in your foot. So really, what pain is, in this example and in many examples, is it's a protective mechanism that helps us survive. So a little bit more about me. I was born and raised in Watertown, and after I graduated from Doctor of Physical Therapy school, I moved back here in the spring of 2016. I have a wonderful wife and two years old and a 3-month-old daughters. And some of the designations at the bottom, those last 2 bullet points, it basically just means that I really like and am interested in learning more about pain. And it's been kind of the better part of my clinical practice and career since graduating from school. It's been with a focus and an interest in pain. So this is our 2-year-old Stella. You can tell she's adapting well to the COVID-19 social distancing. Looking very comfy and very cool with those shades on and the sandals. And this is our 3-month-old Cameron, getting a little more smiley every single day, and just developing and watching her grow is so fun. So when we talk about the science of pain, we'd be remiss if we didn't visit the opioid epidemic and the opioid crisis. So pain is a normal part of life, but living in pain every single day is not. It's estimated that somewhere around 100 million Americans have some form of persistent pain. That rounds out to be about 1 out of every 4. And the United States makes up about 5% of the world's population, yet consumes 80% of the global opioid supply and 99% of the global hydrocodone supply. So we see similar rates of, that 1 out of 4 individuals. We see similar rates in the United Kingdom and Australia as well. So this isn't just a United States issue. This is a global issue. This is a slide looking at deaths per year, and what you'll notice is heroin and cocaine have stayed relatively stable over this 12-year period. But what we really saw a big jump in was opioid-related deaths. So there are lives at stake with how we take care of individuals that have pain, and that's really why a lot of this research has been done. As we looked around and we said, you know what? If we think we're so good in healthcare, why are our patients so bad? Why do they have so much pain, and why are so many more people dying? So that's why a lot of institutions and researchers said we got to look more into this. So really what we're going to talk about today is called the biopsychosocial model of treating pain. So you'll notice in the bottom left-hand corner, what we're talking about is biology, right? So this is what we're actually pretty stinking good at already in healthcare. We understand that there are things with the chemistry and the biology and the anatomy and the physiology that explain why people hurt. And we do a really good job with that. Where there's areas for improvement is integrating more of the psychological and the social aspects of pain. So when I say psychological, I'm not meaning that people hurt because they're crazy. What I mean is that things like our learning, our thinking, our attitudes, our beliefs, how we manage stress, our ability to learn, that impacts our pain as well. We also see the social circle down there, integrating that, things like healthy lifestyle habits. So in social, you could maybe fit in how somebody's sleeping at night, their physical activity, their work relationships, their family relationships, any cultural or religious beliefs. So those things all kind of fit into this treatment of pain. And pain really exists in the intersection of all three of these subsystems. So again, let's revisit that concept of stepping on the thumbtack. So again, that pain would be expected in someone normal in that scenario. And in its purest form, again, pain is that protective mechanism designed to warn us of a threat to our survival. So again, you can think of if you stepped on a rusty nail, or one of the first signs and symptoms of strep throat is a really bad sore throat and the body aches associated with the flu, or oftentimes pain that's associated with a broken bone. Those experiences, pain is signaling us to do something, right? To take care or to seek help. However, living in unrelenting pain every single day is not normal. So with this, as researchers have kind of done studies and then looked into this a little deeper, the focus has kind of shifted to understanding how the nervous system is a key player in the pain that we experience. So even if my shoulder hurts, or even if I have a headache, or even if my back hurts, really diving into the nervous system's role as a key player has been a real game changer in the understanding of pain. We're going to touch on this in a second, but really, and what we're talking about when we talk about the person that is having widespread pain or long-standing pain, is that you can think of it like that nervous system has become overly protective. Okay, so remember, pain is that protective response that warns us of potential threats to our survival. Now, when somebody has developed a long-standing pain issue or a widespread pain issue, where pain starts to spread, that nervous system has become oversensitive, and instead of being protective, it's now overly protective. And one thing that's been really shown to be effective, not in isolation, but with other treatments, is teaching people about pain. So the knowledge is essential to the recovery. This is what we're trying to do, is make the unknowns known. So this again happens in the context of other treatments, whether it's a patient getting a medicine, or then going to counseling, or starting an exercise program, or doing some breathing and relaxation. So this understanding and teaching patients about pain really focuses on the neuroscience of pain. So we're going to go over an intervention that we commonly use in clinic, and this is the sensitive nervous system analogy. So in this picture, what you're finding is you're seeing a picture of the nervous system dissected out, and it's a collection of 400 nerves. If you put them to the tip, it would take us almost to Brookings from Watertown, so a span of about 45 miles. And they're all connected like a series of highways and communicating with one another all the time. So this nervous system functions like our body's living, breathing alarm system. You can think of it as ADT Super Plus Plus, or the most sophisticated alarm system on the planet that will adapt and change without even any input from us. And let's think about how that alarm gets set off. So normally, with the nervous system or the sensitive alarm system, there's always a little bit of resting electrical activity. And that's what you'll notice in the line on the bottom. That orange squiggly line, that represents the amount of resting activity that's happening. And there's a dotted line across the top, that's the firing level. If there's enough of a stimulus, that electrical activity will ramp up and trigger the alarm. So think of the example of stepping on a thumbtack. Right, there's that stimulus where you step on the thumbtack, the nervous system ramps up and says, we got problems. It'll trigger the alarm if there's enough of a stimulus up by that peak, and you'll feel pain. Now when you pull the thumbtack out of your foot, does your pain just go away right away? No, right? You probably gimp around for a couple of days, hobble around as the tissues are recovering and healing. Very normal. Okay. Now, in most cases, over a period of time, the body beautifully calms back down to its normal resting level. And that's what you see on the far lower right-hand side of the screen. That's calmed all the way back down. Now, what's important is that in 1 out of 4 people, when that alarm is triggered and things get ramped up, instead of calming all the way back down to its normal resting level, it kind of gets stuck on the way back down. And it has a new extra sensitive resting level. Now what you'll find is that there's a big change in room between that resting level and that threshold at which the alarm is triggered, or that firing level. So what we do is we kind of think of this as the used to could syndrome. I used to be able to take my dog for a walk. I used to be able to go to the grandkids' ball games. I used to be able to do all these things. But now that amount of activity puts me well above the firing level. Another great way to think of it is it's that resting level of sensitivity has really ramped up from where that gray line was, where it used to be, to where it is now and revved up in the orange. So there's some other things that happen when the nervous system becomes ramped up in response to a perceived threat. So there's some hormones and chemicals that are produced in our body that control the breathing rate, the heart rate, and levels of alertness. So a lot of times patients that have had pain for a long time have really difficult time sleeping at night. They might find themselves just unable to fall asleep at night. We also might find that muscles get stiff, sore, and tight, but not damaged. The concept of I stretch all the time, but I still feel tight. Sometimes that can be more related to the nervous system and its sensitivity. There's little receptors on the nervous system that actually sense movement and loading. So sometimes if we're really stiff, it might not be the muscles. And then there's changes with blood flow to the muscles as well. Also, what we might find is that digestion becomes impaired when the nervous system ramps up and becomes extra sensitive. So oftentimes people that have pain and have hurt for a long time might be experiencing things like irritable bowel syndrome or other digestive issues or food sensitivities as well. We also know that breathing changes as somebody has pain. Often it becomes more shallow and fast. Now, hopefully you're sitting there watching this wondering yourself, well, what causes that nervous system to ramp up and cause all these not so fun things to happen in my body? And in healthcare, this is where some of those other portions of care, other than just the biology, feed into how we feel. In healthcare, we call them yellow flags, but there's 6 of the most common ones, and they're slightly different for everybody. But a history of failed treatments, and notice it's not the patient failed the treatment failed the patient, is how it's more aptly worded. The treatment just didn't work for that person. Family concerns, so that can have a lot of different meanings that we'll kind of get into and look into. Fear and anxiety, which I would think that most people right now are kind of aware of. We're having to social distance and we're having to do some things. Right now with the COVID-19 pandemic, that's causing a lot of us to be a little more anxious about the future and about going out in public and about seeing loved ones. Pain that continues to be persistent. Any job issues or financial issues, and different explanations for what's going on. So I jokingly call these with patients the brown flags, or it's the crud in our life or the crap in our life. And it's going to be slightly different for everybody. Thus, the treatment should be individualized as well. So the different explanations for pain, looking at all the treatment options can leave you feeling pretty stressed out. On top of that, everybody seems to have an opinion, from Dr. Oz to family members to friends, other providers, and it can be overwhelming. And this uncertainty can leave the alarm system extra sensitive because it can kind of feed into some of that stress and anxiety. What about family and job issues? So common questions patients will kind of ask themselves when they're living with pain is they wonder, kind of, does my pain impact how I can do my job? Does it impact how I can care for children or other family members, or how I interact with my family? The money concerns with expensive appointments with healthcare providers or other missed work. Because it's expensive to be in pain. It is. It's estimated that people that live in pain will spend up to $250,000 trying to figure out what's going on and trying to find some relief. So again, family and job issues definitely feed into this. The history of treatments that failed the patient. This can lead to people feeling like damaged goods. Worrying about treatments not working for you when they help somebody you know. Kind of the concept of, why did my daughter or my neighbor or my cousin, whoever, get relief from that injection or massage and I didn't? How about anxiety and fear? So considering the failed treatments, various explanations, job, money, family issues, there can be a lot of uncertainty. With this uncertainty, oftentimes comes anxiety and fear. And that's very common when somebody's had a lot of issues with pain. So the research has shown that fear of injury or re-injury, fear of exercise and movement, keeps the nervous system, or the body's alarm system, extra sensitive. So a lot of times people feel like Charlie Brown in the picture. They're sitting up in bed at night because they're not able to sleep. Their mind is racing. Their anxieties have anxiety, as Charlie Brown states. So hopefully you're thinking to yourself right now, so okay, we've talked a lot about kind of some things that are not so good that can happen when that nervous system becomes sensitive. How do we calm it down? And we're going to get into that. We've already started some of that. Education is therapy, and learning about pain helps to decrease the fear and the anxiety. So research suggests that the nervous system calms down when we understand the root cause, or the key players in a pain experience for somebody. So that's exactly what they did when they looked at this study. And what they did is they took an individual that had back pain, and they laid them in an MRI tube, and they looked at their brain. Now, when I'm talking about the brain, I'm not saying that pain is all in people's heads. What I'm saying is that the brain is kind of the leader of the nervous system. So that's where a lot of research has been guided towards, is looking at pain and looking at how the brain functions and its role in that experience, in that physical pain that we feel. So in that top row, they're just having the person just lay on their back and rest quietly in the MRI tube. In the middle row, what they're having them do is they're having them take their back through a series of movements. So roll this way, move that way. And what you're seeing is a lot of those red blobs start to pop up. What those red blobs represent is it represents different nerve cells or neurons in the brain firing and being active. Now, what's really interesting is you can look at that third row or that bottom row and see that, yeah, there's still some red blobs, but not nearly as much as the middle row. And what's really cool is all that they did between the second and the third row is they taught this person about pain using the analogy that we used earlier, or that sensitive nervous system, sensitive alarm system analogy. And they took that person in that third row through the exact same movements that they did in the second row. So you can already see kind of in real time that there's less processing done by the leader of the nervous system of the brain when we teach people about pain. So we've already started to calm the nervous system down by learning that sensitive nervous system analogy. What else helps to calm the nervous system down? Exercise. And really, you could even title this slide just movement, finding what you can do that doesn't cause you to have a huge flare up for 3 days and pay for it on the backside of it. So the nervous system really craves blood flow and oxygen and movement and space. And we get all those things when we move to some degree. So our nervous system is about 2 to 3% of our body weight, yet it consumes roughly 25% of the oxygen that we breathe. That is an absolutely crazy statistic. And it just shows how much our nervous system craves oxygen and how important it is to get the heart rate up and just to move. So you don't need to start picking up triathlons or mountain climbing. All it takes to get this mechanism to kind of turn on is 10 to 20 minutes most days of the week, just going out for a walk. That starts to get the heart working, the lungs working, and getting that blood flow and oxygen circulating throughout the body. And it doesn't have to just be walking. Finding a mode of exercise that's enjoyable that you can sustain and do regularly. Really, that's the key. There's no one magic exercise with regards to pain. Just finding the one that works well for you. And again, that's why the treatment for pain needs to be individualized. So this is a little fella that looks like he took up swimming. Hopefully you weren't in the pool with this little guy, as maybe he thinks it's a giant bathtub. So keys for exercise for those with pain. It's important to start small. I had that slide back there that said 10 to 20 minutes. There are some patients that we work with that we're pumped if they can start with a 3-minute walk. Everybody's going to be different. Their body's going to have a different level of tolerance to start, and we just have to ease our way into it. It's okay to have a rest day. We tend to encourage the patients to have some form of activity that they're doing most days of the week, whether that's 4 or 5 days a week. But it's okay to have that recovery day, just not 4 recovery days in a row. It's important to have a plan and a partner. That's the best supplement on the market, is finding a buddy or a friend or a companion to help keep you active. Logging your progress and setting goals that are meaningful and fun. So a lot of times it's set, some short-term goals, or okay, what do I want to be able to do by the end of the week? And then having kind of the big goal, the big, fun thing. Maybe it's okay, I want to be able to participate in this 5K at the end of the summer, whatever might have you. It's important to have those goals along the way because they help to keep us motivated and to keep us on track. I'd be remiss if we didn't talk about medicines. Those earlier slides we discussed opioids, and there is a time and a place for those medicines. Practicing in an orthopedic type of setting, absolutely, it's okay as long as patients don't have an allergy or reason not to take their pain medicine if they've been follow the guidelines from your physician. And we see all the time, patients after they get the knee replaced or they have a surgery. They're afraid to take opioids now, and it's okay as long as you take them with the guidance of your physician and your pharmacist. Those guys and gals that are physicians and pharmacists are so good at understanding the medicine and interactions it might have in your body. And just have that open line of communication with those providers to say, what, this doesn't make me feel good, or what, maybe that's a little strong. Is there another dosage that we can get that's different? And they'll work with you. Physicians and pharmacists, they just want to help people too. So again, you're going to take these medicines with guidance from those professionals. That's not what I do as a physical therapist, but it's important that you know about those things. What's also really cool is our body produces pain medicine called endorphins. Those are those feel-good chemicals that our body produces when we do things like understand pain, move, and eat good, healthy food, and get good restful sleep at night to get our body's natural pharmacy back online. When we talk about the individual that's had discomfort for quite some time, it's very, very important that we get their sleep back on track. That is a pillar of the rehab process. And depending upon where you look, some places say 6 to 8 hours, others say 7 to 9 hours. The keys with sleep is that you feel like you're well rested in the morning. And there's a few different conditions that might cause somebody not to sleep well. What we're going to focus on right now is insomnia. There's also restless leg syndrome and sleep apnea. And the restless leg and sleep apnea, that needs guidance from a medical doctor to help with those things. But as a physical therapist, we can take some things into consideration when we talk about insomnia. So this list is not all exhaustive or all inclusive by any means, but there's just some ideas of how to prep your body for good restful sleep at night. So really the biggest one is to have a schedule and have it stay consistent between your weekdays and your weekends. The schedule is going to be an anchor. So having the same bedtime, having the same wake time. regardless of whether it's a weekday or a weekend. It really helps to anchor your sleep so that your body knows that it's 9:30 or it's 10 o'clock, it's time to get sleepy. And over the course of a few days, your body will kind of get back on schedule with that if you're really consistent about it and you're doing some of those other things that are on this list. I also wanted to include this graph. This is called a hypnogram, but really what it depicts is that our brain goes through different phases or different waves when we sleep at night. And most people have heard of the REM cycle. The top cycle there, stage W, is awake or wakefulness. Now you'll notice that this is a normal hypnogram or a normal night's sleep. What you'll see is that there's 2 times where people are awake. It is normal to wake up at night. What's not normal is to wake up and not be able to fall back asleep and lay in bed for hours on end. So if you find yourself being one of those people that wakes up in the middle of the night and can't fall back asleep, it's really important to get up, leave the bedroom if you're physically safe and able to, and go do some wind down routine or wind down activities outside the bedroom, and then return to the bedroom when you're sleepy. So the analogy is you wouldn't sit at the dinner table and wait to get hungry. Why would you lay in bed and wait to get sleepy? So to conclude, all pain is real. Sometimes when people have had discomfort for a really long time, they might have had an encounter with somebody that said, I can't find why you hurt, or quit faking it. And that couldn't be further from the truth. All pain is produced by the nervous system in response to perceived threat or actual tissue damage. And in 1/4 of people, the nervous system can ramp up and become extra sensitive, leading to prolonged pain, even long after the tissues have healed. So every person's pain is unique. Those yellow flag issues are also unique, so their treatment approach should be individualized. And I just want to include, on this slide that these things are examined and looked at after we do thorough medical screening, ruling out big scary things, ruling out the fractures, ruling out significant issues that are going to require help from a different type of provider or require emergent care. And, I think it's important too to also understand that when we look at this and we see that 1 out of 4 people have some form of persistent pain, and we look at that biopsychosocial model and consider that thoughts, beliefs, attitudes, emotions, behavioral things can be significant contributors to this. And we think about how anxiety and stress and depression play a role in this. I think it's time that we start flexing our empathy and compassion gene a little bit more, especially in the context of this COVID-19 epidemic. So I just think that there's a lot of opportunity there to not be judgmental if somebody has a widespread pain issue, because odds are there's more than meets the eye with that. So I want to thank you so much for taking the time to listen today. And if you have any questions or comments, the topic is big as pain science. I know that I wasn't going to answer all the questions that you may have had, but feel free to email me or call the clinic if you have any other questions or need any more clarification. I really appreciate your time, and I hope that you stay safe and stay well.